Hello, Wally Jason. I'm a developmental psychologist, and I'm also the sampling from seeds that we planted in from building upgrades to CPE 2015. And I run the TSU Strong Green Institute. Currently running a contract called Better Places Tennessee, where we recognize workplaces at similar plant levels and trauma informed practices.
I'm RD, I guess, and also I was there, Tennessee feeling very that part of the whole.
You're the best for.
Yeah. And so I'm here in Tennessee, as part of that, and it's called health advocates and I'm also concerned about what's happening in policy levels to children.
Hello, everyone. Stand. As Seneca Seafoods, I come from the Metropolis, Jackson, Tennessee. Is and we provide a lot of services. One of the programs that I'm in is a relative caregiver program. We're families who are raising relative children. Glad to be a part. Jefferson, relative caregiver program. Here as a support member and building site specialist. I'm Cheyenne Rogers, also with the National Caregiver Program. I'm a very advocate for Madison County. I am April Woods. I'm also with RAP, the Caregiver Program. I'm a family advocate for Interstate and Educator County. Hi, my name is Erin. I'm in Tennessee Regional Program Manager for Healthy Families Tennessee at Tennessee, Texas. Good morning. My name is Sarah Gordon. I am also from Tennessee, Texas, with my Aaron. I'm evidence-based as name program director. Hey everyone, my name is Joanna Rosales, and I'm from the Tennessee Department of Health, the Early Childhood section, and I am the case management administrator for evidence-based visiting programs. My name is Prescott Rockman. I'm Senior Director of Grants for School-Based Services with Volunteer Behavioral Health. I oversee our school-based behavioral health liaison with basic and public action grants in Southeast Tennessee. Good morning, I'm Sharina for Tennessee Voices, the Early Childhood Behavioral. I'm Stacey Spears. I'm with Referral. I'm the program director.
Utilities with increased preference.
Good morning, Elizabeth Sedgwick with the Department of Health and Substance Abuse Services. I'm the Director of Juvenile Justice Programming.
Hey, good morning. This is Jordan Wally. I'm with Tennessee Commission on Children and Youth, the Director of the Center for Children's Mental Health and Youth Transitions and Surgeons.
I'm Jen Craig with the Tennessee Department of Health, Director of the Office of Strategic Initiatives. Yes. Good morning. I'm Ashley Sensi, the Technical Assistant Coordinator with the Department of Substance Abuse Services for the regional area. Good morning, everybody. I'm Rachel Hampton. Federal Officer Tennessee and Solution Center.
Good morning, I'm Sharon. I'm National Fire Department and I'm South Tennessee Mental Health Disasters Team.
I'm Grace Seven. I'm an early childhood classroom consultant with Tennessee Voices and Set Pro, which is our early childhood program. Hi everyone, I'm Kina Friday. I'm with the Association of Mental Health in Tennessee, or AMI Tennessee. And our CEO is also here. So it's I'm still with Tennessee Commission on Justice. Good morning, Sasha Taylor with the Shelby County Regional Plan. Thanks to this information out there. Jane Moore, Southwest Regional Coordinator.
Director of the Tennessee Child Welfare Center.
Tell me, Bill, and support specialist at the sports social response service. Taking that into two sequels.
That's Steve Petty.
Yeah, and it's really cool. A lot of our staff has been able to join us today, so thank you to you, Jordan, to TCCY, and Dana Cobb, who is the coordinator, West supervisor, administrator, is out there and these folks. And Christy Paling, who is our Upper Cumberland Regional Coordinator, and Russet Markham Embry, who is our Mid Cumberland Regional Coordinator. So I have almost all the regional coordinators here, which is super fun. And I think Lindsay Cody is also online. Maybe Gabby Smith is our Northeast, Marissa Player is our Southeast, and Carla Walker is our South Central. So we can get you information about them if you need more information about TCCY. And I'm so glad, look, I didn't even move the slides to say, hey, we're going to do introductions and announcements. But I do want to make sure if you're newer to our TCCY world, you understand who we are and what we do. And so really, the commission is an independent, nonpartisan agency created to ensure that our state's policies and programs really just use the most effective research-based, data-based information to promote health and well-being for our kids and families. That is the Melissa version of what that says. So take it or leave it. We were established as part of Tennessee Code Annotated, and so we're excited to be a part of that work. I call these our buckets of work. This is where we focus data and insights. Recently, we released our county profiles. I think that was about a month ago, maybe not quite a month ago. So if you're interested in what a child-centered data shot would look like in your county, you can go to our future dashboard at tn.gov/TCCY, and you can just pick your county and see what it looks like, how it ranks in comparison to the others, or reach out to your regional coordinator. They can get you all the cool things. Collaboration, sort of what we're doing here. We convene our partners, try to help support the work that they're doing. Policy advocacy, we work with our legislators, our partners, our state staff to make sure our policies really reflect the best for kids and families, and then just raise public awareness. Part of our work today is understanding more about what even is a closed loop referral system. How is our state starting to embark or already embarking on that? What are other states doing as they do that? And so hopefully it'll help us. We're not going to answer all the questions, but we're going to start getting that conversation maybe a little more mainstreamed. My goal particularly is to help defeat some silos that always exist, because that's inherent in the work that we do, right? But to help us understand each other and what we're doing. So that's TCCY. So I'm excited to get to introduce to you today my friend Jared Elzie, who's just one of the coolest kids on the planet. I've worked with him at what used to be ACE Nashville, is now All Children Excel Nashville, on our leadership team. Jared has a long history of just really working in the community and collective impact work. Used to be with Meharry, I think, Nurture the Next, just a cool kid. And I heard him do this talk, or a version of this talk, at a symposium last year. And so I'm like, hey, Jared, come talk to us about what he has learned and what he understands and can share with us around what even is a closed loop referral system. So Jared Elzie.
Thank you, Melissa, and thank you, everyone. I noticed I have 40 minutes, and if any of you know me, when it comes to this topic, I tend to go over. So, all right. So as Melissa was saying, this talk I gave at a symposium hosted by ACE Nashville and Belmont University last November. And it comes out of work that 3 organizations did earlier in that year. So it was All Children Excel Nashville. It was the Nashville Health and Wellness Leadership Council, one of their work groups that I'm also a co-chair for. It's the awareness and navigation of resources, community resources, as well as raising Readers Nashville, another collective impact in Davidson County. And so the three groups all had in their want to do list was establishing a closed loop referral system. And so this report is all about the work we did, the data we collected, and at the end of it, what I am calling the closed loop referral system manifesto, which everyone seems to laugh at when I call it a manifesto, but you know what, it is. Okay, so I guess I'm just, let's see if this works. Hey, it works. Got it. So quick rundown, what I'm going to present, talk about what a closed loop referral system is, some terms to know, not necessarily for this presentation, but just to get familiar with it as everyone starts talking about these things more often. The partners we had and the responses, what we gathered out of it, blah, blah, blah. Then we get to the meat of it at the end, which is the responses we got from our surveys and key informant interviews, and then the manifesto. So what is a closed loop referral system? This is something we've already been doing for decades. So I don't want you to start thinking this is some new technology, this is new something. It is any process that allows a service provider who has a consumer, client, customer that needs services from someplace else. And so they refer that person over to another service provider. They send the same information along that the CBO might need. They get the referral connected, and then they get feedback on how things went. That's closing the loop on the referral that was made. Now, historically, we have been doing this by telephone. We've been doing it by email. We've been doing it by meeting people for lunch. And then we will give the information over on a sticky note or something else, or copy and pasted or something. And then maybe after we remember 3-4 weeks later, we'll hit that CBO we made the referral to up and ask them how things went. And maybe they'll get back to us in a month, and maybe they'll have that information for how the consumer's doing. That is a closed loop referral system. So don't think that this is something intimidating. It's just helping people out and getting information back to see how well it went. So the little graphic is just identifying the person in the need and where they can go, tracking the information along the way, getting the feedback, and doing follow-up on whatever else might be needed. Now, of course, there are lots of other names as the technology got involved. So anytime you see one of these listed in a symposium, in a talk, as an organizational initiative or whatever, generally there are some nuances that make differences in these, but these are all the same thing. They're all working on how do we coordinate data and services to people in communities between different organizations that don't obviously have the same administrator, have the same data systems, or have even the same clients. So any of these, when they come up in future days, years, whatever, it's basically the same thing as a closed loop referral system. I'm not offended if you want to call it something else. That's just what we landed on. So some of these terms, these are things that, like I said, you don't have to remember today. I'll point out the ones that are important. So interoperability is just how do you get all these different systems to be able to talk to each other? Because one team is using Salesforce, another one's using Excel, another one is using RedCap. Interoperability of those, and it also includes the devices that are connected to them. So what operating systems are you in? What's your software ecosystem between the organizations? So that's interoperability. Used to hear a lot about that after the Affordable Care Act, because that was part of what the healthcare industry was supposed to do, but totally failed. Master Person Index is an important one. It is how these systems take all the different data sets and identify the individuals in them to see how they're duplications. Like, are we serving John Smith and are you serving John Smith? Or you? So this is how all this comes in, and it centralizes the data into and recodes all of the individual data records with a single number for that individual, and that's called a master person index. There are variations on this, but it's generally the same thing. It centralizes the data. That is done through extract, transform, and load processes, which is how, actual staff pull information out of the database, transform it so it can go into the centralized one and put it in there so that everything comes out with the information you're expected. And that's how MPIs are created. One other thing, well, not one other thing, this is a bunch of different things, but these are the most important things. So while everyone gets excited about the technology and what platform are you using, what vendor have you hired, what are you building yourself? The technology is not the most important piece of this. Going back, we've been doing this for decades, right? It is all about how the data is shared, the rules around what data gets shared with whom, when, and if that needs to change, who makes those decisions, how's the community involved? So that's all under data governance. So having a plan for data governance up front before you've decided on technology is the best way to go. So any community that's tried to implement this will tell you consistently that when it comes down to getting the organizations to agree to share data, everyone's on board up until that point. Everyone thinks it's a great idea. It's obvious. It'll make services so much better. When it comes to actually turning on the key, flipping the switch and sharing data with other organizations, for some reason, CBOs get very nervous and a lot of them end up backing out. That's because the data governance hasn't been put in place properly. And there's just general concerns about sharing very sensitive data with other organizations that are your peers, but also your competitors, and that just gets sticky. There are data stewards and wranglers. Those are the folks who actually navigate these agreements and actually dig into what the data is going to need to be transformed and loaded into the master person index. Next thing I want to point out is that when we started talking about this, I say we, kind of like the royal we, 20 years ago or more, because this conversation has been going on for a very long time, technology was not up to speed with what we really needed as a community. And that became evident as the ACA rolled out and as other things rolled out. We started looking at the vendors. The technology wasn't able to provide the kind of privacy and data security that was really necessary when you're dealing with these vulnerable populations. I will say that has changed quite a bit in the ensuing decades. And now we have privacy preserving technologies that are really quite astonishing. Two of them that I highlight are differential privacy, which adds a type of randomness into the actual data when it's transmitted that can only be removed by the system that put it in. And so even if this information gets hacked, stolen, dropped off in a laptop at the airport or something, it's useless if they don't have the system that actually encoded that differential randomness. There's also homomorphic encryption, which allows to encrypt the record level of an individual to a point where it's not readable, but still can do calculations and different permutations on that encrypted data based on the type of encryption it is to give you the answers you're looking for like, what's the percentage demographic overlap between two organizations? And I can say this with confidence that it works because ACE Nashville ran a pilot prior to the pandemic where we ran one of these programs with a company out of Oklahoma that actually demonstrated it could be done. And it went really well and was very successful. And we were able to identify overlap in the users of the services between the three organizations with something like 98% confidence. So nobody's data left their house, and we could still tell through the encryption and the calculations on it how much overlap there were and lack of overlap there were in the people being served by those organizations. So national standards, obviously this stuff has been in the works for a while. These are things you should know for future days. The Gravity Project started in 2019. It was a huge collaborative that I think was run out of Stanford. Someone who knows more can remind me who ran this, which standardized social drivers of health data that could then be paired with all the healthcare data that the ACA was supposed to force everyone to share. They developed a set of international standards for the exchange of this kind of electronic health information called Health Level 7 International, HL7. You'll see that come up a lot. There's also FHIR, which came as a subset of HL7. And then there's also one of the technologies that has come up as a best practice for privacy preserving data sharing, which is federated computational governance, which allows the data to stay in the system of each organization, in our case, CBOs or state government entities, and still be shared, but the data stays decentralized and stays, the domain for that data is self-sovereignty. So the CBOs don't give up their access to the data. They don't have to sell the data to the vendor that is then going to put it all together for them, and they have to pay to get it back. And it creates interoperability and some automated platform decision execution, which takes human error out of the process. So that's a really important data architecture for these types of initiatives. So onto what we did. as a group. So like I said, this came out of the Community Health Improvement Plan, which is governed by the National Health and Wellness Council. This is the Navigation and Community Resources Working Group, Raising Readers, Action Team 5. They did the data collection for this, and ACE Nashville helped coordinate the presentation and kind of the whole operation of it. So the CHIP they actually put money in the game and conducted a bunch of key informant interviews with a variety of major stakeholders in Davidson County. And so this is a list of the folks that they sat down with for a couple of hours and asked them a bunch of questions that we wanted to find out as we got going on building awareness about closed loop referral systems. The survey data was run by Raising Readers Nashville, and it included early childhood educators, pediatricians, and residents in a variety of zip codes in Middle Tennessee, not just Davidson County. So these are all the services that were represented between the survey and the key informant interviews. And so we just asked them, what do you do? What area do you work in? And this is the list of things that came up. So we covered quite a lot of ground, not everything, obviously. It's pretty hard to do everything at the get-go of this type of work, but we covered a lot. So we felt very confident in what we got back. We also asked them what they're currently using for closed loop referral systems. So this is a list of softwares, platforms, vendors, other systems. I have an asterisk up there for find help, and I'm very excited to be here today. But very much look forward to all the other presentations that follow me. And thank you for Melissa for letting me go first, wherever you went, because now I don't have to think about doing this presentation. I can actually listen to the rest of it. So as you can tell, a lot of these aren't actually closed loop referral systems. They're just technology systems that are being used to track clients and track who they were referred to input the information if it comes back. I would hazard to say, and I hope to be corrected later today, but I would hazard to say that none of these are true closed loop referral systems. They are very well developed and very useful, far more useful than what we had 10 years ago. Referral databases for who to connect your clients to, and then gives you information on who to follow up with so that you can then close the loop yourself. But very few, if any, actually have this built into their technological DNA to actually have the closed loop in the system itself, which is one of the things that we'll get to at the end. But if I am wrong, because I know there are some people in here that will be presenting and are representing technology companies that do this, please let me know, because I'd love to update the presentation. Because sometimes I feel like a little out of my depth that someone's going, no, we're doing that. So come tell me and tell me that you're doing it. So this is what came out of the key informant interviews when asked about the use and the benefits of a closed loop referral system. I will say that when we got all this information back, there were no surprises because we've already been working in this space. We already know what the needs were, but we wanted to confirm it. And so this is what we got. The pros, everybody wants a one-stop shop, a no wrong door solution, be able to follow up on the outcomes of what happened with their client when they went for this other service. You can see on down the line. The cons, they also were not surprising. Cost, the incentives for being in the network, the capacity for additional data entry, which is something we're all familiar with. How many people have more than one system they have to enter data into, right? And so every time you get a new funder that has its own flashy system that it wants you to put data in for your reports and everything else, it's like, okay, who's going to do this? Who's going to do key in the data? And we got to do the same data 3 times for 3 different databases, 5 times for 5, depending on where you work. And it sucks up an enormous amount of time and creates a huge amount of errors in every single one of the data entry processes. Maintenance and sustainability. There are concerns around what happens if the vendor that we've invested all this in goes up, gets bought, and they no longer want to serve this. How do we get our data back? Does our whole operation have to go back to square one? The one we did not expect, which was really great to have pointed out, was the idea, because we were working this for Davidson County. A lot of folks had concern about county line barrier for being in the system or being in the network. It's like most of our clients, we're on the border. We're working in Rutherford as well. We do a lot of Middle Tennessee. So the idea of no geographical boundaries needs to be navigated at the data governance level as to where people in the system are going to come from and who you're going to allow in and what's going to muddy the water. From Raising Readers Nashville survey, the top barriers from the providers that responded, so those professionals that they surveyed, there's not enough information on resources to give families, and there's a lack of handoff coordination between organizations. So basically, there's a need for closed loop referral systems. From the residents, we got a variety because this came from all the different zip codes. It was in multiple languages. And so the communities within Davidson County had different response rates for each of these, but these were the top ones. There's no awareness of resources available. Up to 66% of the communities we surveyed said they rely on word of mouth to find resources when they need it. Scheduling for English speakers was the top barrier. Cost for Spanish speakers was the top barrier. Process difficulty for even getting, registered and discovering if you're eligible, and then how do you jump through the hoops to get services was a top barrier for everybody. So, I'm doing great. Okay. So we pulled all this together with the information from the key informant interviews, from the community surveys, from our own expertise within the 3 organizations, which represents a bunch of CBOs, and put together our community design closed loop referral system manifesto. So these are the 5 points that are non-negotiables, at least in my opinion, and that's what I'm going to say here. These are non-negotiables for rolling out one of these systems in a community. And I think that any other community will have very similar ideas as to what they want to see in this type of system. I know it's hard to read, so I broke them down one by one. First priority is to use best of breed privacy and usability architecture, like the federated computational governance that I was talking about earlier, which we don't need to get into, but just be aware that there are technologies that do this. So the reason I harped on master person index as centralized data and the extract, transform, and load process for it, it is an enormous security risk. We should not be using MPIs at this point in technological development. These things they're a huge risk when they're created. So if you think, let's just say several administrations ago, couple maybe, when there was a call from the federal government to get information on anyone who's ever been on government subsidy of some sort. Master Person Index gave them instant access to that kind of thing. They were able to subpoena any organization that was running with one of these and just say, give us your master list. Under the federated computational architecture setup, that's not even possible. They'd have to subpoena every single organization that is sharing data in there, which doesn't make it, okay, I take back the word impossible. It makes it very difficult. So MPIs are a bad idea, both for bad actors, policy that may be harmful to the populations that we're trying to serve. So anyways, you can read the rest of it. And from a technological standpoint, it also bottlenecks computation, slows things down. The next thing is invisible data pipelines. A closed loop referral system is only as useful as the number of organizations that use it, that participate in it. And one of the reasons that providers don't want to participate in these things when they come around is because it's another machine to feed. It's one more data system that they need to enter in the same data that they've been entering into the other systems all day long. So a technology that—
Oh, it's shared.
Hi. So ease of implementation and maintenance is paramount. Minimal impact on the partners that join in. And when I mean minimal, I mean like as minimal as can possibly be achieved. Because CBOs, nonprofits do not have the bandwidth. It wastes a whole lot of administrative time when rather we'd be serving consumers. Equitable remuneration. This is something that definitely comes up when the healthcare industry is the one who's driving the adoption of one of these systems for a community, because they're getting money back from the government based on value-based reimbursement and other ways of doing it. And they're basically farming out the work that they're going to get paid for to the nonprofits. We need to make sure as a community of CBOs, that the work that's actually making that happen is getting compensated appropriately. I don't know that it has to be like the biggest piece of the pie, but it has to be a reasonable piece of the pie based on what that system, what the major player is getting from rolling this out in the community. Because without all of us, the whole thing doesn't work. It also has to be sector agnostic. I know that everyone here is in sort of the early childhood youth wellness space, but these systems don't care about the type of data that goes into them. And so if we start thinking about 2-3 generation approaches to taking care of children, we need to be able to provide services to those who are caring for the children as well. So elder care, dependent care of other types. So the system itself needs to be designed to be sector agnostic. So anyone who has a stake in the wellness of the community can join into the network and can't be like, well, we deal with, the homelessness database. We deal with this other population. And then the technology provider is saying, well, we set this up for early childhood, so we don't really have categories for you in our system. It's got to be sector agnostic. And it has to have a minimal entry cost because CBOs were always like right there, trying to just run right between the red and the black because we're trying to expend all of our budget so we can say that we're being responsible with our funding, but we're not like hoarding money because that looks bad too. And we're not running in the red because that just means we're going to get our money yanked anyway. So there has to be a minimal entry cost to participating in these. So again, this is the whole manifesto, and I'm happy to share this table with anyone who wants it. And if you want to argue with me on any of these points, or let me say, enlighten me that I have missed something or that things have changed since we did this, I would love to hear from you. That's how you can get a hold of me. There's my email. And 18 minutes. Anybody have any questions? I even brought a notebook up here to write down your questions so I can research them.
No questions, you want to go talk about that?
Please.
Sure.
Okay. 1 and 2.
2 questions.
Okay, 1, 2, and 3. Yes. Well, I mean, I know it exists.
System.
For its own purposes, but I would not say not in a sector agnostic sense. So for its own purposes, you could possibly consider it that way, yeah.
You mentioned that the system can identify like duplication of services between agencies. How specific can that be? For instance,
Okay.
if a family is getting specific assistance from one agency, is it going to define that that's because different agencies might be able to give a certain type of assistance to a family, whereas another couldn't, but they still need both. We don't want to cause elimination of services to families just because it's not a high level title.
Right. So the deduplication I meant in there is deduplication of the individual. So if John Doe is here, John Doe is here, John Doe is here, they can figure out, oh, these are duplicates. It's all the same person. And then create a single record for John Doe across all the agencies. So it wouldn't necessarily, I didn't refer to it as duplication of services because the services will have different distinctions from their funding. And so the funders will have their expectations on what you can and can't do. There will be distinctions between those. And so that would be something to work out during the data governance development section or step of the process. So the organizations that have similar programs, but not identical, can navigate that. Do we track this in the system or not? Or at what level of general similarity will we track? But understanding that doesn't mean that they're getting the same service because these are different services. So that's all navigated by the community as you develop these. Richard, oh, microphone gone. Oh, sorry, I should repeat these.
It's great. This is a great manifesto that's come out in terms of the stakeholders in the national and put manifesto together. This is our next step. Is there a desire among the stakeholders across the multiple sectors to have a standardized community information exchange platform to be used in national, or what is the next step?
Yeah, so this is literally the next step. This meeting, which was thrilled to see, is basically about closed loop systems. So it is this. It is getting as many organizations familiar with the idea, bringing them up to speed on the terminology of it, on the available applications of it, the steps that are necessary to develop, because we don't think, we're calling it a closed loop referral system, thought about changing our reference to that, because it's not a system as we think of, it's not a technological network database. That's part of it, but that's probably the least important part. The most important part is getting the organizations together. For one thing, to tell the health, for instance, sorry for everyone here from healthcare providers, but to tell the healthcare systems, if you're going to pay millions and millions of dollars and expect all of us to use this system, here's what we want from it. And if it's one-off complaints from a CBO here and there, like, oh, this is so much more extra work for us and they pay in the butt. And the hospital system is like, well, that's what you gotta use because that's what we're paying to, and we're letting you use it for free, so it's what you gotta have. But if all the CBOs say, sorry, no, thank you, you suddenly, that pulls out the power differential away from the major stakeholders who've already made the decisions without considering the community input. So the next step is this, it's talking about it, getting folks familiar with the idea, because from the key informant interviews and from the surveys, everybody's excited about the possibility of doing this. But the next thing is, what's it going to cost me? How many more personnel do I have to dedicate to entering the data? Is the data going to be secure? Like, these are the top questions every community has. And usually the stakeholders that are putting all the money in so that they can get their value-based reimbursement are ignoring those questions or diminishing that, let's say. And if I'm wrong on that, please correct me as well, because I tend to want to be a little bit confrontational about it to bring people into the conversation.
They call them community.
Yes, yeah. San Diego 311.
Exactly. Here in Tennessee, TennCare.
With Find Help.
Yeah. Child TennCare. Family.
Right.
TennCare, and there's a gap.
Well, I will say this, that it is my instinct that the direction that Medicare, Medicaid, TennCare, the direction that they go is basically how the industry ends up following eventually, because they're the biggest funding source in the country. So, from that standpoint, Find Help is way ahead of the pack, in my opinion, at this point. So then it becomes, what communities have already adopted something else, and how is that going to work with this? Are these interoperable? If they're not interoperable, how are we going to make them that way? So it creates an entire new market for vendors to come in to create middleware that'll get the systems to talk to each other. So we can actually have a decentralized, like, it's all in the mix and it's all a mess. And we're trying to get ahead of that by getting the CBOs on board with demanding certain things, or at least I shouldn't say no. I will take the blame for it.
Yeah, it's a great job on doing the groundwork and doing the foundation to make these decisions. But you have to gather the stakeholders together. So it's important to this before we make a decision. I took a job.
Oh, thank you.
Putting that together. So,
Yes. Sweet.
Yeah, Vision Link or our system does support true closed loop referral and can interface with the other systems via API.
Via API. Comment on APIs. Yes, that is true. I do not know those systems, so forgive me if it sounds like I'm skeptical. But I will say our experience with the healthcare information exchanges that tried to roll out during the Affordable Care Act eras, all of the companies, all of the major health system interfaces, what we have now, which is, like Epic and all of its cohort, all of them agreed to the government, we will develop these APIs and we will allow all the other systems to plug into them and pull the data in and out through these APIs. But what they did was build APIs that sucked, that intentionally didn't work. And so because hospital systems don't actually want to share information on their patients with other systems. And so while they followed the law by building these APIs into the platforms, they made sure the APIs didn't work. And so after 10 years, 15 years of trying to make it work, everyone got tired of the conversation, just gave up. And so we still don't have interoperability. So I'm always skeptical whenever a vendor says, yeah, we can interoperate with any other platform because we have APIs. Well, let's see the quality of your APIs. That's a fair, there are better ways to set up information exchanges than that. So, sorry, I'm a bit of a downer.
Are you working on this so that it will be live or live? If a client goes into one facility
Yeah,
and then goes to another state, there is an interchange that alert goes out and lets you know. Because we do have different individuals that go searching.
again, yeah, back to that county line barrier issue. So that includes state barrier, like any geographical geopolitical border is gonna be something that needs to be navigated. We ain't there yet. We don't have it for our individual communities quite yet, so.
Because I was trying to do something today to help with the opiate and the overdoses. And to alert organizations in the state that was also giving those individuals of what was going on when it came to a crisis.
Yeah, well, and I would say the crisis level gets people motivated to share data. A lot of the data that would be shared in this kind of a system, because it should be sector agnostic, is going to feel less crisis driven and people will be less motivated to do that kind of interstate cooperation. It's just gonna be a lot of work. It's gonna be a lot of meetings in rooms like this and bringing people up to speed and getting agreements. Again, back to the data governance, that needs to be set up first prior to the technology and figuring that part out. This is awesome.
I have a question about encryption
Sure.
secure. So are you saying that a patient's information could be allowed through the encryption if by address or name or what kind of?
So I won't, if I said it that way, let me revise what I mean. The creation of a master person index creates a risk. It may be secure, like when I think about so like some of the federal regulations around HIPAA and high tech and like what we need to do to make sure that the technology, the encryption, the security of the data within a system is secure. I consider that to be CYI ethics. CY, you know what I mean? CYI. It's the baseline. So it can check all those boxes. And there's quite a lot of boxes, like from the technology standpoint, the ONC, I forget what that stands for, but in like the technology administration for the federal government, there's the stuff that they require to meet their cybersecurity levels is meaningful. Like that is, it's not a joke, it's good stuff. But still creating a centralized database of all the information of vulnerable populations establishes a risk because cybersecurity is a constant arms race between people who want in and you trying to keep them out. And so it's always changing. And usually it only changes when a vulnerability has been discovered. If you take away that brass ring, that centralized database, there's no incentive to try and crack the encryption because there's nothing on the other side of it. If it's a decentralized database and you have the encryption that goes along with it, and it depends on the type of encryption, which gets into a level of conversation I'm not prepared to explain. But what we ran through with our privacy preserving technology pilot was some really cool algorithmic stuff. There's a white paper online about it. It's like a 30-year-old concept out of the DoD that this company put into practice, and it actually works pretty well. So that to say, they can say that their centralized database is secure from the federal government standpoint, but you're still holding it all in a single box in a safe in a bank. And that's where all the robbers are going to want to get into, and they're going to keep trying until they do. And when they do, like how many security breach notifications have you individually received in the past year? 12? And like the biggest one included like 300 million records. Like, and those are the best of the best. They get cracked annually. So take away the decentralization, makes it much harder for someone to figure out where the stuff is. Sure. That is why I'm very eager to listen to the rest of these presentations. I think it was Art.
Yeah, I mean, it's the days on this is very. What I hear you say is citizen lives.
Absolutely. It already is.
Just in general, best just is for decentralized.
Right.
Awesome. Is that things toward more focused data on specific cases and to all have more data and really all tokenized kind of things in-house. So we can get it to share those things. A lot of times it needs to be shared. So what it's called, and expendable push back with decentralized data management.
So I think this gets to what you're asking. There's in computational science, there's always a tension between privacy of data and usability of data. The more private you keep the data, the less usable it actually is. And so if everyone was completely locked down and never shared data, we wouldn't be able to do any data sharing between us. But opening it up too much puts that data at risk for the centralization point and, information in transit kind of thing. So knowing that that has been a longstanding problem in computer science and data science, a lot of very smart people have been working on how to develop architectures and data access arrangements, let's say, that do their best to preserve a level of privacy that is acceptable to the community, however you define that, and is still usable for the purposes that we're collecting the data. Now, if we just start collecting all the data we can and we don't know what we're going to do with it, that's a waste of time, creates enormous risk. So we have to be very intentional about the data we do collect. All that to say, this kind of solution has been established in the business community. Corporations have figured this out. Advertisements in the middle of your streaming service for that same thing within like 5 seconds. Like I've literally watched that happen. I'm sure many people here have. They've already figured out how to share this data. There was a company called Crypto Numerics out of Canada years ago that had created a solution for corporations where corporations could keep their data housed. They would feed their encrypted stuff up to a single server. And so like 3 major corporations would never have to share data with each other, but then they would be able to get information about how all 3 of them are working in the market. But they never learned anything about the individual level records that were held within the corporations. And it was kind of the basis of similar technology as what we ran in our pilot project for our CBOs. That company was later bought by Snowflake, and Snowflake has benefited enormously from that. But they run this in corporations all the time. It's just nonprofit world, the human social services world. We don't even think about it. We don't even know about it. We don't have access to it because we don't talk to the business community unless we're asking for money. We need to get access to the technology they've already implemented to kind of surveillance capitalize everybody so that we can do this in order to support people. So the technology is there to balance privacy and usability. It's just way more technical than I will be at this point in my life. There are people out there that know how to do that.
So what this actually reminds me of is how cryptocurrency applies in the market, the blockchain.
Yeah.
And where everything, there are different servers, and those servers have to communicate instead of being centralized, such as like currency is doing, central system, having different servers that are constantly communicating, verifies that transactions are actually legitimate. One of those servers, this doesn't look right, it tells the others, and it basically stops the hack, which stops the and even the bad players do something. So I think that's very fascinating. My question is though, if to the people that would serve, how is this going to be explained to them? And with it, they feel comfortable with it, because the general public would be.
Oh, yeah. Oh, yeah, for sure. Yeah, well, that's something we need to navigate as well. Like, this is the kind of conversation that, let's say I'm 60% leaning this way. This is a conversation that doesn't really need to be had with the public, which is gonna sound awful based on what I'm saying. Like, my general approach to this, like, no one's listening to the community. But for instance, there was a program that was being run out of Nashville, a service, let's just say, to keep it generic, where to sign up for it, you had to use a QR code. And no one used the service because everyone was like, I don't know what this is going to do to my phone. I don't know what I'm about to download. I don't know what this data is going to be used for. So no, give me a paper form. Something as simple as that. It's like, well, you're still giving us the same information, but because it is a QR code on a phone, no one wanted to use it because they didn't trust it. So it's going to be trust in the CBOs that are providing the service, talking to their consumers, that's going to really affect this. So the CBOs really need to be the ones who know this and then be able to explain it at a certain level appropriate to the client base, the consumer base for your services. So if your doctor says, if you like your doctor, I'm going to refer you to this service over here. I really trust them. I've worked with them before. I really like what they're doing. You can go to them and get your surgery or whatever over there. You're not going to be like, well, give me the details of the surgery. Give me the details of the equipment they're going to be using, what was the device application like to the FDA? Give me the scores that came back. It's going to be trust in the CBOs and the relationship that they have with organizations, which is why we need the CBOs on board with these things. And not on board like whole cloth, but punching holes in them, asking questions, coming back and saying, you know what? We've talked to like dozens of our service recipients and they really don't like this aspect of this. Is there something we can do to assure them, or is this something that you've addressed? And it might be something where it's like, we didn't think of that one. We should plug that hole before we roll this thing out, or as we roll it out, fix it in post. So yeah, it's the relationship between the CBO and the consumer, not necessarily doing a PSA about closed-loop referral systems to the community, because I think that would just confuse things and drive people away.
To be respectful, we're
Oh.
talking about one more.
Okay.
And then
Dang it, I was doing so well.
back to last time with your email. If you haven't figured out already, Jared, guys, I know probably people get to them.
Whoop.
Feel free to email. There we go. Feel free to email Jared if you have others or catch him after. Slap him.
Question is, who do you think is the best host for data governance? Not the system.
Who's the best host for? Who's the best host for a data governance? Who's the best host? As in say, an organization that is responsible for administrating it all? Oh, gotcha. So not like server hosting. Okay. Oh, that's a really tough question. Because in some communities, it's going to look different for each community. So there may be a trusted anchor for the social services in a particular community that looks very different than another one. It could be government. And in other communities, that's the last thing you want. It could be the major funder, like a United Way within a community. And sometimes that may be the last thing the community wants. It could be a new coalition of shareholders, of stakeholders in it that create a shared governance board. In a lot of ways, that's what the CHIP is doing. So one of the groups that helped put this together, the National Health and Wellbeing, Nashville Health and Wellbeing Council, and their work group that I'm on, the Awareness and Navigation Resources, are pretty much taking the lead in Davidson on this. It's not a government entity, but it's a government sanctioned entity. It's a bunch of CBOs coming together to work on this issue. And so I'm not saying that they should take the lead on it, because I think that all of them will say, oh, no, thank you. But something like that. It's gonna look different for every community. I know that's not a helpful, but.
It's a.
Right.
Chair. Again, one of the coolest kids, as Rob mentioned, that we know. So I am super excited that Sasha's gonna come fix something happening up here for our online friends. And I just want to say, that my computer is the one we're running the Teams and the presentations from, so I can't get to email. So I've been using my phone. Our online friends, if you've been trying to email me and give me information. However, my phone just decided to update itself. So I might be a scooch behind, but, it is what it is. So I want to say thanks to Sasha for helping me be a cool kid when it comes to, the Teams piece. And again, to all our friends, from TCC Live that are helping keep all the parts in motion. I will say for those of us in the room, we will have lunch coming in about 7 or so minutes. So please ignore what is happening to your right. It'll be a scooch distracting, but just pray about it and we'll focus. My friend, and several of your friends, I think, from South Carolina, Karen Oliver is the program manager for, I used to have that in my head. First Five South Carolina, but some sort of coalition within state government. So Rob introduced me to Karen and we had a lovely conversation to help me understand a little bit more about First Five. I also believe DHS is working with First Five. I think our early childhood friends also may be working with First Five. Look at that, Early Childhood Advisory Council. Sorry, Karen, that's the part I couldn't remember. So she has generously agreed to talk with us about this piece of a closed loop referral system. She will, I think, very willingly say it's not perfect. Nothing is, right? But it's what South Carolina is doing to help address kind of streamlining systems for our kids and our families. And it's within state government. That's what I think. I was like, you're a government employee? And she was like, yes. So I just thought that was so cool. So Karen, if you want to unmute yourself, let's make sure we've got you. I'm going to advance her slides for her.
Testing, sibilance, testing. Can y'all hear me?
Yay. So do
All
I
right.
need to put my microphone up to my speaker? Will that help? Sasha's the speaker.
I don't know. How are y'all doing over there? Can y'all hear me in the audience? I bet the virtual folks can probably hear me. Okay, great.
Don't
I
hold
am-
on just a second, Karen.
Okay, sure. I am super excited to be here. I'm just waiting for the slides to progress.
Very intentional.
Are we ready?
2 seconds, Karen.
Okay, yeah.
I think
So what I'm going to do is start chatting so y'all can, I'll catch you up with the slides in a minute, but I am the program manager for the Early Childhood Advisory Council, established through the Head Start Reauthorization Act. And the assigned responsibility went to the organization that hosts the Early Childhood Advisory Council, South Carolina First Steps. By statute, we pull together all of the state agencies that have a vested interest in early childhood. And thank goodness, through the funding of the Preschool Development Grant, we were able to build the First Five SC portal. It is a cross-sector, cross-system entity. It engages the folks who are responsible for Medicaid, SNAP, local parenting programs, McV, that would be maternal, infant, early childhood, home visiting programs, the range of programs and services that are great for children under the age of 5. How are we doing, folks? I can talk with my hands if that helps. Can we progress the slides, please, so I can take you on a run through our system? Maybe. Can't, yeah, I don't see I still see the last slide of Jared's.
Okay, maybe. So, is there not feeling?
This is
Yep.
a hoot, folks, because I asked Melissa to share the slides thinking it would be easier than me trying to share them through the Teams
She might need to
portal.
share.
Would you like me to try to share after all? And I'm frozen. Delightful. Okay. Can y'all see that? Probably
Yes.
not. Can you see? Terrific. Can you see family-centered information portals? Hopefully in the, not in the, hopefully not
I see it.
in
I'm on
the,
virtually. I see it. And but the
okay.
slides are over to the side, like the layout, slide layout over to the
Okay,
side.
yeah, let me see if I can make the reading view, the slide sorter. Oh, here we go. We're almost there. Let's try this, people. How's that? Can y'all see just one giant slide in the virtual screen?
I still see multiple slides,
Oh,
like 1 through 6.
one through all of them. Okay, I'm going to stop sharing. Technology is a beast. So here's what I'm going to do, folks. I will send the slides to Melissa and she can share them with you. And I'm still going to ask Melissa to see if she can share the slides. Let's try one more time. Zoom slideshow. Let me just try.
Do
And
you
you're
have
still
to?
seeing the slides?
Yeah,
Yeah,
now
I'm
I see
trying.
it's back to the one. If you click enable editing, does that make it where you can?
Maybe.
If you select
Maybe.
enable editing and then up next to that, you'll see in the upper right, present in Teams. Then it'll do what you want.
Where's present in Teams? Sorry, missing that one.
It's up in the upper right corner of your PowerPoint presentation.
Yes. Okay. Present in Teams. Got it. Present in Teams. Yes. It's asking me to save stuff. This isn't what I want. Present in Teams. Yes, I do. Yes, I do. Oh, this is not working, people.
They're going to jump off Teams and come back on to see if that they can get up and going.
They're going to do that. I'm fabulously interesting. Can y'all see, can you see a series of 6?
I don't see anything now. It's just the photo,
fabulous.
the people gallery.
Okay. The people gallery, great. Okay, let's try one more time. That's not working.
And when you click to share,
Yeah, it's
you're
not.
probably seeing a couple of different options. It's probably giving you share like window or share
Yeah.
like application. And that's where when you were sharing your PowerPoint, it was sharing the application and not sharing the window.
I'm completely out of my depth at this point. I'm seeing Matt Marshall talking. It looks like I'm not sharing anymore.
Right.
Is that correct?
That's correct.
That's
Well,
right. Yeah,
I
we
am
can't see you
wasting
anymore.
all of our time on this, aren't I? Let's see. Can you
Okay, now
see
we see
the
the
6?
1 through 6. Yeah.
Great. You know what? We're just going to stick with that. I promise to
Okay.
send the deck because we're already behind because we all love teams. So, welcome to First 5 SC. We are in fact a Webby honoree. For any of you who are total web nerds, the Webbies are the Emmys of the web world, and First 5 SC was in fact an honoree when we first launched. I am now on looking at slide 3, and what you see are a lot of bubbles. And what those bubbles represent are the federal funding sources that then move down to state agencies that do programs for families, especially those that serve children prenatal to 5. Parents do not need this labyrinth or maze of bubbles. They don't need to know that in our state, the maternal, infant, early childhood home visiting program is administered by the Department of Public Health or Children's Trust. They just want a home visiting program. So, slide 4, First 5 was born through the ECAC. And in order to drive this program, we really solicited the feedback of families. We talked to parents in every single 40 of the 46 counties in South Carolina. We listened to more than 7,500 people and frequently do they can't hear me in the room, so virtual people, yay for us, and sorry, people in the room. We listened to family voices, and so we designed and co-created a system that is useful for them. What you need to know is this is not a closed loop for referral system. This is a coordinated eligibility system where very easily families can use their mobile device, another word for phone, to find the range of publicly funded programs and services for which they're eligible. I am now going to take you. This isn't going to be any fun, people, trust me. But what we do is through our warm and welcoming portal, we invite people to determine their eligibility for up to 40 programs across the state. The programs are geolocated, meaning if a program is available in the upstate, but not in the low country, a person living in the upstate will only see the programs for which they are eligible. You'll see we have a path across the top of our windows, and it starts simply with the name and email address of the parent. This information gives us something we call leads. This is like going to the state fair and saying that you would like to get an estimate on replacement windows for your home. You have shared some contact information, but it hasn't obligated you to anything. And we do ask the child's birth date, but not their name. Then we go to through the slides. And what I really want to draw your attention to is what looks very complicated for those of you who can see slide 10. This is where we consolidated the eligibility criteria for up to 40 programs across the state. So SNAP, Medicaid, home visiting programs, WIC, any number of them use the experience of homelessness as a criteria for engagement in the program. What we've done is consolidate all of those 7 programs that say homelessness is a criteria and ask the question once so that a family only has to answer once to find out if they're eligible for that 7 to 10 programs. This is almost better than a Webby, because this required working with our state agencies across the gamut for them to agree that this is the language that is plain and easy to understand and is dignified according to parents, and that this is the one place where they can answer the questions once to find out the number of programs for which they're eligible. If you look at slide 11, it is the last item on the path of eligibility, and it does ask for your family size and your annual income. I know that there are lots of ways to calculate family income, but we found with families that this was the best and most reliable way to determine income eligibility for a family across a range of programs, some of which are 185% of poverty, some of which are 213% of poverty. All of that information gets calculated on the back end, so nobody has to do the math in their head anymore. If you look at slide 12, this, based on our sample of a parent in Allendale County, South Carolina, these are the programs for which that family is eligible. That includes our child care vouchers, WIC, free 4-year-old kindergarten, and some local programs. And if you look at the bar below, you will see that you can apply for those programs right there. There are other programs for which people are available, and they are encouraged to go and get more information, but they are not currently on our common application. If you determine that you would like to participate or sign up for a program, you can do it in one of two ways. You can do it as a guest, or you can create an account. Creating an account allows you to upload some of those documents that are also required for applications, like proof of residence, pay stub, social security information, into a secure vault, because once you're in the application environment, we are HIPAA and FERPA compliant. We would continue with programs. We've determined that you are eligible for many programs, but you only have to apply for the ones that interest you. If you have other needs, or you're not finding what you need, we have some connections to navigators who can help you. I am now looking at slide 18, and I want to let you know that it cost about $1 million to build this portal. And we probably spent about as much promoting it, because you can build it, but if you're not letting people know it's out there, it will not be used. Through some philanthropy, we were able to develop First Five for All, and I put that in the chat for those of you who are virtual. You can download our toolkit and get some information on how we built it and what we did. If you want to look at our really nice video that explains how First Five works, it's there as well. So please take a look. Finally, we do think it's working as a coordinated eligibility platform. It was not designed to be a closed loop referral system, but it was designed to become the trusted resource for programs and services for families with young children. And so last year, we had about 99,000 visitors. 5% of them checked their eligibility, and another number did use the common application that was available. I want to brag a little bit, because 66% of the folks who are using this portal are coming during non-office hours. That means they're coming on Saturdays and Sundays, after kids are after the children are put to bed. This is designed to help families easily find what they need, so then they can proceed to applications. And I always close with families, because this is the reason we did it. We designed this program so that families with a phone can find what they want, need, and deserve in a very efficient, effective, welcoming way. Wow. So technology was not our friend today, but I'm wondering if there are any questions or comments before you move on to lunch and your presentation from the United Way. Big fan, by the way. Any questions?
Thank you so much, Karen. That was a whole journey.
That was a whole thing, right?
I know this is the beauty. This is the beauty.
Right.
We were recording from a different computer. So it is, your presentation is recorded and I will
great.
send that presentation afterwards for our friends. So I think all of our online people had a big time with you. Thank you so much. Folks in the room, we'll that when it comes back.
Yeah.
But
And
let's
Melissa,
see if there's any questions in the chat.
Melissa, if you could share the deck that I shared with you, that could be helpful to the folks who are in the room. Looking through the toolkit now, is the language used for the application and screener in there? No, you'll probably have to go on site to find it, but let me give you a little gift today. This is the gift that I'm going to encourage you to take a test drive. If you go to testfirst5sc.org, you can pretend you're a person looking for programs and services on our test site. This is not our live site. It's where we build before we publish. And I only ask that as your name, you put in test and your email as test@test.com so you don't corrupt me. But please, and I think that
So
Melissa
Karen,
has
let's
my
make sure
contact.
everybody knows as your username, it's test as your email, it's test@test.com. And then as password is test.
No, your username is test. Your email address is test@test.com or test.org. It's fine. And I'll just share my email address and phone number because we'd love to talk with you. I have my friend and colleague Austin Reed online today. He is our new First Five leader. So he would be more than happy to take you on a drive around First Five if there's any interest.
Awesome. I think we've got about a 2 or 3 second lag. So thank you. I do have another question in the room. If you'll introduce yourself, Richard.
What is the technology platform that you're using for the portal? The technology platform that you're using.
I didn't hear the question.
What is the technology platform that you're using for the portal that may have been in your slides, but we may have missed it?
We worked with a vendor who built this. It's bespoke. And 37 Gears is the vendor that we procured through state procurement. And they are using something called Umbraco. So it's kind of build your own too, to some degree. We have a lot of responsibility for building some of it ourselves, which is really nice because we don't have a ticket system where we get charged every time we need to correct a typographical error.
Nice. Okay, thank you. I know
I can also
questions in the
share.
room are going to be limited.
Yeah, I can also share, if anybody's interested, the solicitation for the portal, meaning like what we put out to bid, including the questions we got from potential vendors that we reviewed and then responded to in advance of the submission of proposals. it's a time saver if anybody's really serious.
Awesome. Our sweet friend Connie Kasha
I
says
saw.
to say hello to Crystal Campbell. All right. I will forego more questions in the room simply
Yeah.
because we missed the presentation.
Yeah, we're
But
so sorry.
like I said, it will be, it's not fault. We got a hot spot here at the library, so I think we're rocking and rolling now. I'm sorry that was busy. So we all good that you're here with us. All right, thanks to Karen Oliver from South Carolina. And we will move on to our next presenter. I think my friend Matt Marshall is going to introduce him. So Matt, I think you are with us. Oh, I see you, Matt Marshall. So I will say Matt Marshall is the executive director, if I'm using the right word for that, of the United Way of West Tennessee, a great partner for us and just a good human, to be sure. He is also a member of our 21-person commission. So the Commission on Children and Youth, we are the staff. There is an actual commission of 21 people appointed by the governor. They serve 3-year terms, so it's kind of a rolling in and out sort of thing. They can serve three-year consecutive terms. So Matt is one of those commission members, and we're thankful he is here with us today.
Yeah, thanks so much, Melissa. Good to be here for what is a very important conversation for our state. And I'm not really here to present today, but rather to introduce Mike Mudd to all of you. Mike is a Senior Director of 211 and Community Resources at United Way of Greater Chattanooga. As Melissa shared, I have the pleasure of being the CEO at United Way of West Tennessee, but over the past 2+ years, there has been to unite our 211 efforts in every community. And so Mike will share more details about the collaborative, but if you're not aware of 211, it is an emergency assistance hotline that has existed in the United States for 2 or 3 decades now at this point. And in many communities, United Way is the one who is helping facilitate that service, sometimes in collaboration with local government. And so we, over the past few years, have been, again, collaborating to make a more unified system. And so Mike is going to come on and share more about that and how that connects with the conversation that's being had today around closed loop referral platforms and those types of things. And so I'm going to turn the mic over to Mike.
All right. Thank you, Matt. And good morning, everyone. It's afternoon over here on Eastern Standard Time. But I know that it sounds like you guys are probably hungry. So I'm going to try to make this pretty quick. So I've just wanted to kind of highlight a couple of things from the discussion so far. So I mentioned in the chat that the Vision Link system does support closed loop. And so I'll touch on that a little bit on the next slide. I'm assuming that everybody can see my slides.
Yes.
Yes. Okay. All right. So United Ways of Tennessee, we've spent the better part of the last 2 years just coordinating our efforts to make sure that our systems are coordinated and streamlined. And so as part of that success, I just wanted to kind of highlight some of the things that we've accomplished. So we do have a universal information referral system that's used across the state. That would be Vision Link. And Vision Link does support closed loop referrals, and it is automated. So we use that currently here in the greater Chattanooga region. So if we provide a referral to an agency, there's multiple ways you can do it. Most of them use the email method. So they get an email notification saying that someone has been referred to them. They click on the link, they can go in, update notes, and then they can mark that service was provided, when it was provided, if they weren't able to provide it, and the reason why, et cetera. And so all of that stuff is done seamlessly through the closed loop system. It does support bi-directional APIs, so we can interface with another system so that they could work in their system independently. When we provide a referral, it would just automatically appear in their system via API, and then the update would return to us via API. So it does support both of those. It is also has the availability for HIPAA compliance and then all of the other certifications. I don't know if any of y'all are going to be familiar with the level of those certifications, but GDPR, CCPA, and then FHIR. And the system is built on the AWS system, so it's SOC 2 audited. We had a SOC 2 audit last November and came back with no mediation. So just from a security standpoint, it is a very secure system. Through this effort of getting everybody onto the same system and having not just a unified system, but unified metrics and KPIs, we're also working on statewide disaster response. And so we're doing that through INR and telephony. So you'll see that a couple of spots down on the slide here. But what we've done is built a statewide hub that just connects all of our phone systems so that if individuals call, if there was a disaster in one region that took out a call center or limited the availability of that call center, we're able to very quickly pivot and route calls in a round robin style to the rest of the state, guaranteeing that individuals will get the service that they expect. We provide emergency assistance as well. So some of the United Ways in the state do provide direct emergency assistance along with the referral process. And this system does provide comprehensive reporting. So through we have the ability to build out custom reports, dashboards to be able to provide a visual for those custom reports, and then we're able to share that in the community, which we do regularly here in Chattanooga as well. And then statewide coverage being the main thing. So you'll see in the map there at the bottom of that slide that those are the 5 major United Ways, and then Clarksville that covers the entire state. And so an individual that calls 211 or dials 898 211 via text, they're going to get routed to the correct call center to support their needs. Our directory is available in each of these regions as well. And we have resource coordinators at each of the location that is verifying all of the resources on a revolving basis so that we're certain that the referral or the resource that we provide to an individual is a viable resource. And so we do that through some automated systems. It's just called our RUM module. It just allows us to schedule out those updates with our partners to ensure that they're able to log into the system and provide any updates. If an email address changes, or they have turnover, or any service has been removed from their offerings, that all of that is updated in real time within our system. And then just in addition to that, it's the trusted relationships that we have on the ground. That was talked about a little bit in the earlier presentation as well, but our relationships with the other nonprofits, for-profits, corporations, city, county, all of our local leadership that we partner with to make sure that we're providing the most comprehensive referral system and services that we can for our community members that are in need. And so those are just some of the things that I wanted to highlight. And then just for numbers' sake, in 2024 across the state, we helped 187,285 clients. And of that number, there were nearly 200,000 referrals or direct assistance that was provided. And so, as I mentioned, some of the United Ways do have direct assistance that would provide assistance for somebody who's maybe their lights have been shut off, their electricity's off, their water has been cut off, they're facing a potential eviction or a foreclosure. So we partner with other organizations within the community to make sure that that doesn't happen. We here in Chattanooga, I don't have the numbers for the rest of the state just right off the top of my head, but we assisted in just about $800,000 in 2024 in direct assistance. And so highly encourage folks to contact 211 if they have a need. And the systems that we have in place currently and the availability of technology, especially with the APIs, we leverage APIs with our data on a regular basis, both internally and externally, so that we can share that information with our community partners to better assess gaps in coverage within our communities. I'm sure most of you all are aware, especially in rural counties where there's just a lack of services. Populations are more sparse, and you have smaller towns, smaller communities where in a bigger city or metropolis, you're going to have much more available resources. And so we're leveraging that data in combination with our ALICE data to just make sure that we're aware of where there are gaps in the service, and then trying to provide a more comprehensive service to the community so that an individual is not, I use the analogy you've all heard, you give a man a fish, eats for a day, but if you teach him to fish, then, he's going to eat for the rest of his life. So what we're working on is trying to develop relationships with our partners in the community so that when we provide a referral to an individual, we're also doing a better job of intake to determine what is the root cause of their current situation and what are some other things that we could provide within our directory and through our partnerships that would help that individual to get to a point of sustainability. So we want for families to be able to be independent, and especially our focus has been on those ALICE households. If you're not familiar with ALICE, it's just an acronym for asset limited, income constrained, but employed. So these would be individuals that are employed, they have children, but they're living right there on that kind of cliff level within the economic world. So, something happens, they may be living just pretty close to paycheck, but then something happens and their car breaks down and now they're in a crisis. So being able to provide some method of upward mobility is our main priority. So again, we don't want to just help somebody with their immediate need. We want to try and assess what has caused this immediate need and what can we do as United Way and through partnership with those partners that we have in the community to make the situation better for this individual. And so kind of with that, just to give you a sense of like what types of folks the community is dealing with. This is Tim. He works here in my office. He's been with United Way 211. He will hit 40 years this October. So that I think that one of the main benefits, and I mentioned relationships in the community, but the navigators that work on my team and the other teams throughout the state, these are people that genuinely care about people. They have a compassion for people. They're dealing with people typically on their worst day. And, these are all calls that people that are typically in crisis and need help. And I'm very proud of the team of folks that we have in Tennessee that service these calls and do it with compassion and do it with respect and do the best that they can to try to help individuals. And as you see here, I mean, Tim is obviously our most senior, be 40 years this year, but we have folks that have been here for 15 and 20 and 10 years. And so these people are, they're deeply involved in the community. They're very aware of everything that's happening in the community, the resources that are available. So, I mean, they're kind of a resource directory on their own. I mean, we do leverage the technology, obviously, to make it simple, but most of my tenured folks, if they get a call, they know exactly what resource they're going to pull up in the system to assist an individual in that moment because they're familiar with the resources that are available. And you have resources that are dependent on the proximity of an individual. So that's one of the, it's kind of mentioned in the previous slide, but you can search by zip code. You'll have some services that are only offered to individuals that live in a specific zip code. I kind of tell people it's like going to the grocery store as far as calling 211 or going to our directory yourself. If you know exactly what you're looking for, you know what you want to search for, you could just go to our directory, search for that thing, pull it up. You can see the eligibility requirements. If there's an intake process, what the phone number is, address, it actually links to Google Maps. So if somebody's using their phone, they can immediately get directions to that location. But if they're not sure what they need or what help is available, then you call 211. And so it's like if you go to the grocery store and you just go to the self-checkout because you just want to get something quick, get out, but you got a cart full of stuff, you want to have somebody else do that for you. So we do encourage folks to call or text 211. And so, all of that just to say that, we've worked very hard to develop a comprehensive system within the state that unifies us as United Ways in the state so that we can better serve our communities, better leverage technology to create efficiencies to be more effective in serving the population around us. So that's pretty much it for me. So are there any questions? I know we discussed some stuff on APIs and things, so I didn't know if Jared had any questions specifically about some of the functionality of our INR system, but happy to answer any questions that anyone might have.
Oh, there we go. Gosh, I mean, I think there's a lot of Wi-Fi happening in this room, and my thanks for joining us and thank you for connecting us, Mike, and always your support. Mike, you didn't hear us, but we all chuckled when you said maybe Jared had a question or something to that effect. So I don't know if there's any in the chat. Okay. I can
Yeah,
chat.
there is
I think there is one in the chat.
Yeah, there is a question here about the difference between 211 and then 211, 211 benefits kitchen. And so I'm happy to answer that. And so they are related. They are related programs of United Way, and they are both utilized across the state. So Benefit Kitchen is our assessment tool that people can use their cell phone. If they text the word benefits or benefit to the number 211 211 anywhere in the state of Tennessee, it will pull up an eligibility screener for them, very similar to what we saw with First Five out of South Carolina, not quite as thorough and robust as that. It will it will show you your eligibility for for 15 different items, things like SNAP and WIC and childcare eligibility as far as a certificate, also a handful of other things. And so we do promote that. And we had that system set up to go to 211, 211 on purpose, because we also wanted people to remember that there is a 211 platform that if they ever need assistance, they can call, as Mike was just sharing. So they are slightly separate services. There are times where our resource folks, when you dial 211, when they answer that call, they sometimes will walk people through that Benefit Kitchen screener, depending on what their need is. But thank you so much for asking that question, because that is an important service that we also offer across the state of Tennessee.
Thanks, Matt. Any questions in the room? It was entertaining yesterday. We were on a meeting with Dr. Wally Dixon and some of his people from ATSU, and we were talking a little bit about the agenda today, Matt. And Dr. Wally noticed that Melissa McGee introduced Matt Marshall, who introduced Mike Mudd. And so I just told them it was the MM show today. So that was a good Marshall Mathers, Jagged M&M. I've been here.
That's right.
So I don't see, Matt, could you please share your email address in the chat? I see that.
Yeah, absolutely.
I can send Matt's email far and wide, but I'll let him do that. Anybody else in the room? Others? Oh, in. I think that's what you said, Matt, in. Oh, yes. Hang on. Jared has a question.
Find help and care. How's that putting through a lot of this?
Do you repeat that question, Melissa?
How are you, and if you are, how are you planning to interface with Find Help and TennCare?
Yeah, that's a good question. There's conversations that have been had around that by the various United Ways across the state. Again, as Mike had shared, we over the last 2 years have been working on our system of collaboration between the different 211s across the state to kind of all get on the same platform, utilizing the same system, and then also bringing our partners on board onto that platform as well, which, by the way, generally speaking, yes, Mike mentioned that, we can connect with them via API if they're already utilizing their own cloud-based system. But we are also, many of us are giving access to the system to our local partners if they don't have a system, so that they can have something that they can utilize as well. And we're making that, I know in West Tennessee, we're making that available for free. But as far as it pertains to the Find Help question, yeah, we've had some conversations with them. I know others have had some conversations with them as they have continued their pilots with some of the local healthcare systems. I know West Tennessee Healthcare here, based in Jackson, is one of the first pilots. So we met with them it was maybe about a year ago, not quite a year ago. And so we're still in conversation. So can't really say anything definitively right now. At United Way, we're always open to partnerships. I think it is important to highlight, as Mike mentioned, that one of the things that United Way has as an advantage is that we have prior relationships with all of these communities because we've been here for so long and been doing the work for so long. And so, we're happy to share as much as we can. But also, as Jarrett mentioned earlier, there are things to be considered in that process. Particularly around the most valuable thing that any organization owns is its data and its relationships with its people, with the clients that it serves. And we want to always make sure that we're providing, as Mike mentioned, the most excellent service that we can. And so, in any conversation around partnership, we just want to ensure that that's the case, that people are getting the best service that they can and that they're getting their needs met. And I know that sounded like a very political response, a very politically correct response.
I mean, I wasn't going to say that, but you did well. No. Well, thank you, Matt. Thank you, Mike. We appreciate you being here in the interest of time and the fact that we've been staring at food for a few minutes. I'm going to go ahead and wrap our morning up. So are you online, friends? We will start back right around 12:15, 12:20. So feel free to do your thing and we are going to do our thing here. So I'm going to do this and